For as long as humanity has gathered to break bread, alcohol has been a guest at the table. It has been a mainstay of our diet, a social lubricant, and a source of celebration. But as the centuries turned, society began to realize that this guest often overstayed its welcome. What began as a tool for relaxation revealed itself as a potent architect of harm. For generations, the rules surrounding drink were designed merely to keep the peace, to stop the brawls and the disorder in the streets. But in the modern era, a new protagonist emerged in this story: public health. The narrative shifted from simply policing bad behavior to a desperate battle to save lives. The story takes a dark turn in the grime and cobblestones of the late 17th century. Britain was locked in a bitter political and religious feud with France. To hurt their enemy, the British government made a fateful decision. They choked off the import of French brandy and threw the doors open for British gin production. It was a decision that succeeded too well. London was soon awash in spirit. By the 18th century, the average person was drowning in 6 gallons of gin a year. For the poor, trapped in squalor, gin was a cheap escape. But the escape became a prison. The gin craze tore through the social fabric. For the first time, women who had been barred from alehouses drank alongside men. The spirit earned the grim nickname Mother's Ruin, as addiction left countless mothers unable to care for their young. The tragedy was written in the graveyards. Between 1730 and 1749, 75% of children born in London died before their 5th birthday. The government panicked. They passed 8 different gin acts between 1729 and 1751 to stop the social evil. But the thirst was too strong. The laws only drove the trade underground, birthing a black market of bootleggers. Peace only came with the Gin Act of 1751, known as the Tippling Act. By recognizing that the immoderate drinking, by persons of the meanest sort, was destroying the nation's health, the government finally cracked down on distillers selling to unlicensed merchants. The fever broke, and the craze subsided. A century later, in the 1830s, the dust of the Industrial Revolution brought a new clarity. Reformers looked at the slums and saw that alcohol was the common thread tying together poverty, child neglect, and economic ruin. From the rugged landscapes of Scotland, the Glasgow and West of Scotland Temperance Society was born, the first of its kind. The movement spread like wildfire across the UK. It evolved from temperance, moderation, to teetotalism, a demand for total abstinence. The lawmakers responded not with bans but with clocks. They began to control time. In 1881, Wales went dry on Sundays. Throughout the Victorian era, a web of licensing acts was spun, tightening the rules on who could sell alcohol and when. As the 20th century dawned, the strategy shifted from moral judgment to administrative control. By 1972, local boroughs were given the power to decide their own hours or even go completely dry. This evolution culminated in the Licensing Act 2003, a massive overhaul that handed power to local councils and established licensing objectives. Suddenly, directors of public health were given a seat at the table. They became responsible authorities, tasked with challenging any liquor license that threatened the community's well-being. In Scotland, they went a step further, explicitly making protecting public health a legal licensing objective, a gold standard that advocates are still fighting to bring to England and Wales. While bureaucrats managed licenses, a landmark victory occurred on the roads. In 1967, the Road Safety Act drew a line in the sand: 80 milligrams of alcohol per 100 milliliters of blood. Before this, the roads were a lawless gamble. Since records began in 1979, this single policy has helped drive down drink-driving deaths by 87%. In the 21st century, the battleground shifted to economics. If you cannot ban the drink, you can make the harm too expensive to afford. Enter minimum unit pricing, MMUP. Introduced in Scotland in 2018 and Wales in 2020, this policy ensured that the stronger the drink, the higher the price. It targeted the cheap, high-strength cider and spirits that echoed the gin craze of old. The results were immediate. Scotland saw a 13% fall in alcohol deaths, with the lives saved concentrated in the most deprived communities.